This is a quick video on low back pain in a 2-year-old child. 2-year-old child with low back pain, how is that possible? What could bring that on? Well, watch this video and you might get a little clue to how that develops. Hi, my name's Drew Coverdale. I'm a physiotherapist and author of The Pain Habit. I talk about all things pain and help patients change and let go of persistent pain. If it's the first time you've been here, then click on the subscribe and keep up to date with any other videos related to pain that might pique your interest and help you learn a little bit more. If you've got any comments or questions about any of these videos, feel free to post and I'll do my best to answer them below. I'm just going to explain a little scenario about the experience of pain in a 2-year-old child. I just want to give you the description or observation of something I noticed in clinic, and it wasn't with a child that I treat. It was a child that I observed as they observed someone else receiving treatment. So I was treating my mother-in-law and she had some neck pain and some low back pain. She'd been coming to the clinic for a number of weeks. So she has this little girl, she's called Erica, and she has her a few days of the week. So over the past few weeks, she's been observing the physio sessions that Nana's been receiving. She might have been sitting quietly in the corner of the room or chattering away or drawing or maybe just wandering around the clinic room like kids do sometimes, poking and pressing things. So when that's happening, it's always fascinating to wonder what's going on in their heads at that time. Anyway, my mother-in-law said to me that before this particular appointment, she said that she mentioned to Erica she was going to go to see Uncle Drew to get some treatment. And at that time, Erica was just playing with the toys or whatever she was doing. And as she recognised what she was going to go to, she put a hand on her back and said, "Oh, my back's hurting." Now, I just laughed and I laughed when I heard. But it's fascinating to think that a child, once they make the association with coming to see me, that represents maybe someone getting attention or getting care, being looked after, attended to. If you think of the world through a 2-year-old child's viewpoint, they only see it through their eyes. It's hard for them to interpret anything else other than things that fulfill their needs. So if she's making the association with treatment at the physio clinic, going to see Uncle Drew, and getting attention from that, then having pain validates getting that attention. It actually might be a way for her to get some attention. So she says, "Oh, my back's bad." And she has no concept of pain. She has no idea to read or write. The learning is all through observation and experience. So the point of this, I suppose, is to say how easy it is for young children to follow the patterns and behaviours of adults, and they do that with most of the learning in those early 7 years of life, in those early 2 or 3 years, at an age when they can't even go to before they've even gone to school. They learn a lot of these things, and pain's part of that learning process. They learn through observation. They see how other people are attended to when they have pain. They recognise how they are attended to when they're in pain. And we've all maybe feigned pain occasionally, and normally that's checked and corrected, and don't cry wolf and those kind of stories. And it's always important to check pain out. Is there what is the meaning of that pain? As soon as you get the meaning, quite often the pain goes quickly. It's that signal to attend to yourself. But if it's learned as a signal to get attention when there isn't, there's always a meaning for pain, but it's presented as an alternate problem. It's presented as pain due to something that isn't actually real. Then there's a bit of a danger in the development of that person, if you like. And normally we all get that adjustment. That means we know that we know not to cry wolf, and we understand pain in its and we understand the meaning behind most of the pains we get. But sometimes with persistent pain, we miss that meaning, we misinterpret it, and it can lead on to the ongoing experience of that pain, when if you could get the true meaning of it, we'd be able to let it go. So it's fascinating when you look at the academic side of pain and neurochemical and neuroscience bits and pieces of pain. It's interesting to those who are interested in it. But it's really interesting just to observe that 2-year-old child, my niece, just observing, seeing her interpret pain in a really natural way. Every day is a school day. We're all learning, and I hope you learn from these videos. My name's Drew Coverdale. Thanks for watching the video today, and take a little bit of time out to plan the next step in your recovery.